Hello, my name is Maiwan Banai, athletic therapist and sports injury rehabilitator, and I teach clinical Pilates in Kilkenny. Today the topic that I am going to talk about is anterior pelvic tilt, which is usually associated with back pain. First of all, we have to know what is the pelvis or what is anterior pelvic tilt. So this area, the hollow as a bucket of water or whatever, or as a bowl, you see this is the pelvis. So it sits here, it sits at the base of our spine. So if there is any distortion or any discrepancy in the alignment of this pelvis, that negatively affect the curvature of the spine. For example, the pelvis could be excessively anteriorly tilted, it means tipped really forward, or it could be back posterior pelvic tilt, or one side could be higher than the other side. However, the most common discrepancy that's common and it's usually associated with back pain is excessively anterior pelvic tilt. Okay, in saying that, I am saying excessive because 4 to 5 degree anterior pelvic tilt for male, or 7 to 10 degree for female is normal. I mean, that's normal. However, when it's excessively tilted really forward, and that causes problem, it creates an arch there, hyperlordosis there, and those facet joints diffuse together too much, and they're under constant pressure, and those erythrospinae muscle at the back, they become hyperactive and they develop trigger points and they become more ischemic, and it just give birth to a lot of complication. So that we know that anterior pelvis, if I just pull this really forward, a lot of pressure is created here. That excessive pelvic tilt that we know is, so now we are going to talk about what causes the excessive anterior pelvic tilt. The major contributory factor to excessive anterior pelvic tilt is the tightness of the hip flexor muscles. Hip flexor muscles are the muscles that we use when we lift our leg. Psoas muscles, they come all the way attached to the lumbar vertebra, and then they insert there on the big bone, the femur, the big bone of our leg. And in addition to that, there is another muscles, it's called rectus femoris. It is just one of the group of the quadricep muscle. It's attached to on the anterior inferior iliac spine, and it just go down to patella and attach there. So usually those muscles are tight. They are tight because of our lifestyle, mainly because our lifestyle is too much chair sitting. And when we are chair sitting, those muscles are being held in a tight position, in a shortened position, and they become very hyperactive. Probably our ancestors did not evolve in an environment where we had all those furnitures or all those fancy luxuries that we have now. They sat cross-legged on a flat ground. In a way, our evolutionary progress did not catch up with our social progress. And there has been numerous studies that shows that sitting cross-legged on the ground, and it engages all muscles in active harmony. It engages the shoulder muscle, it engages the neck muscle, it engages the abdominal and the hip muscle. Okay, while chair sitting too much, it engages some muscle excessively, as I mentioned, those hip flexor, while this engages a lot of other muscles, a lot of main muscles. So it gives rise to a lot of problem, too much chair sitting. In addition to the worst of all, that too much chair sitting deprive disc of their oxygen, because remember, disc needs oxygen in order to breathe. They get their oxygen from the blood vessel on their periphery. So in a way, like too much chair sitting is disc freezing posture. I would even advise somebody who's suffering from lower back pain to avoid too much chair sitting if they can, and then if they can sit cross-legged on the ground. Okay, so now that we know that the tight hip flexors are one of the major contributory factor to anterior pelvic tilt, that studies has shown that it pulls the pelvis forward. Other reciprocal muscle, which are the bottom muscles here, the gluteal muscles, and they are weak as well. When they are weak, their job is to pull these muscles are being used when we extend our hip and they are usually pulling the pelvis back. However, when they are weak, so their function is not optimal there. And in addition to that, those abdominal muscles that attach to the pubic symphysis, they are weak as well. Their job is to pull the pelvis up while they're weak and the hip flexors are tight, so the pull goes really down. In addition to that, those muscles at the back, they are tight as well. Okay, so now we know that these are the muscle imbalances that contribute to the excessive anterior pelvic tilt that causes back pain. How do we treat them? Okay, my initial approach in clinical Pilates would be to kind of stretch those hip flexor muscles. Stretch them in a way that our pelvis is being held in a neutral position. A lot of the time those stretches are being prescribed while the pelvis is being held in an anteriorly tilted position, which is not very effective. And strengthening exercises for those gluteal muscle, kind of strengthening exercises to isolate them. Because a lot of the time when people have those weak gluteal muscle, their hamstring is hyperactive and sometimes it is weak and lengthened. And a lot of the time what happens is, so when we train them, that problem can be solved there as well. And in addition to that, I will be giving strengthening exercise for abdominal muscle and stretch those muscles, and those muscles can be released. Hopefully with doing that, we will drop back the pelvis a little bit back so that we can decrease the amount of excessive anterior pelvic tilt. When that's decreased, then the pressure will be decreased here on the lower spine. And in that way the problem can be solved. And saying that, there could be many other reasons that causing anterior pelvic tilt, such as being flat-footed or having slouch shoulder or too much thoracic kyphosis. And saying that there could be many other reasons as well for lower back pain. I mean, excessive anterior pelvic tilt is not the only reason that people could have back pain. However, it is very common. Hope that video helps, and if you have any comments in regard to that, please leave your comment and I will get back right to you. Thank you. Bye.